So here's a question I get a lot. What is a normal blood sugar? And it sounds like it should have a simple answer, but unfortunately it doesn't. Because normal and optimal are not the same thing, and what your lab report flags as normal and what actually protects you from complications are two very different targets. Today, I'm going to give you the full picture what your blood sugar numbers actually mean, and what happens in your body when they stay too high for too long, and why that process is so damaging and so sneaky and exactly what range you should be shooting for and why. I'm also going to tell you what it feels like when blood sugar goes too high and too low, because knowing those signs can genuinely save your life. This is one of the most foundational episodes that I've done, and I want you to share with everyone in your life who is managing type 2 diabetes or is at risk. This information matters, so grab your coffee and let's get into it. Let me start with what the numbers actually mean before we talk about what they should be. Blood sugar is measured in milligrams per deciliter, or you might see mg/dl, and this is how much glucose is present in your bloodstream at any given moment. And that number changes constantly throughout the day based on what you eat and what you drink and how you move, your stress level, how you sleep, and a lot of other factors. When we talk about blood sugar targets, we're usually talking about a few different snapshots. You have fasting blood sugar, which is measured at least 8 hours without eating. You usually check that when you wake up, and that kind of gives you the baseline. And then you have a post meal blood sugar, which is measured about 2 hours after you eat. And this tells you how your body is responding to the food that you just ate. And then you have A1C, which gives you a 2 to 3 month average of where your blood sugar has been living overall. Now, here's where I need you to pay close attention. The standard ranges that labs use to flag results as normal are based on population averages. They're set at a threshold where the research shows the clear disease risk. And that's a useful place to draw a line for diagnosis, but it's not the same as the range where your body is truly thriving metabolically. So when you look at your lab report, the standard lab reference for the fasting blood sugar is usually under 100 milligrams per deciliters, and that's considered normal. Between 100 and 125 is considered prediabetes, and 126 and above is usually diabetic range. But here's what I want you to know. Okay, research consistently shows that blood sugar complications, meaning the damage to the blood vessels and the nerves and the kidneys and eyes, that begins accumulating well before the 126 threshold. Okay, so a fasting glucose of 95 is technically normal by lab standards, but it carries more risk than a fasting glucose of 80. And most providers are not going to flag 95 as something to address. Optimal fasting blood sugar is between 70 and 90. That's the range where your insulin is doing its job and your cells are responding appropriately and you're not quietly accumulating damage. For your post-meal blood sugar, the clinical target for people with diabetes is usually under 180 after 2 hours after eating, and that's really the ceiling, okay? Now, for people without diabetes, blood sugar typically stays under 140 after meals, and then it returns to a baseline like around 90 or plus or minus within about 2 hours. So your two targets are really simple. You want to stay above 70 and you want to stay under 180. That range is what we call time in range. And I'm going to come back to that in a few minutes. Now, I want to explain something that I think is one of the most important things you can understand about diabetes and blood sugar damage. It's something that most people have never heard explained, and it's called glycation. Glycation is what happens when your sugar in your bloodstream kind of sticks to proteins in your body. And I want you to think of it like this, okay? Imagine your blood vessels, your nerves, your organs as being made of flexible, smooth, healthy tissue. Now I want you to imagine that tissue getting coated slowly over time with a sticky film like honey. That coating changes the structure. It makes things stiff where they should be flexible, and it makes things rough where it should be smooth. It also makes things a little brittle where they should be stronger. And that's what glycation is. And it happens continuously whenever blood sugar is elevated above optimal range. Your A1C test is actually measuring glycation. It measures the percentage of your hemoglobin, which is the protein in your red blood cells that has been glycated, meaning coated with glucose. So an A1C of 8.1, like where I started, means that 8.1% of my hemoglobin was glycated. That number reflects 2 to 3 months of elevated blood sugar doing that sticky coating work all throughout my body. And here's why this is so dangerous and so sneaky at the same time. Okay. Glycation is silent. You don't feel anything. You don't feel anything happening to your body. There's no symptom in the early stages. It accumulates quietly in your blood vessels, in the tiny little capillaries that supply your kidneys and your retinas in your eyes, your nerve endings and your kidneys. And so by the time the symptoms actually show up, the damage has often been building for so many years. This is why diabetic complications like kidney disease and vision loss and neuropathy, cardiovascular disease feel like they come out of nowhere. But they don't really come out of nowhere. They come out of years of elevated blood sugar doing its slow, invisible damage. The goal of everything we do, the protein first, the walking, the sleep, the whole foods, all of this is to keep the blood sugar in a range where glycation is minimized, where that sticky coating process is happening as little as possible. And lately, this has been my goal. Because you cannot undo that damage that's already been done, but you can absolutely stop more from accumulating. So let me talk about the time and range that we discussed a little bit earlier, because this has become one of the most important metrics in diabetes management, especially as continuous glucose monitors have become more accessible. So if you use a CGM or continuous glucose monitor, there's a time and range, and it's exactly what it sounds like. It's a percentage of time your blood sugar spends within your target range. And then usually the target range is between 70 and 180. And on your CGM, on the app, it's going to be a green graph going across. The clinical guideline for people with type 2 diabetes is to be in range at least 70% of the time. And that means more than 2/3 of your day. Your blood sugar is between 70 and 80. And that's pretty much the standard target. But just like fasting blood sugar, standard and optimal are unfortunately two different things. If you can spend more time in range below 140, and ideally between 80 and 130 most of the day, then your risk of complications drops significantly. Every percentage point of time and range you gain is meaningful. And it's not about being perfect, of course. It's about the overall pattern. This is why a CGM, a continuous glucose monitor, is such a powerful tool. Instead of a single fasting number that you get in the morning or once a year or every 3 months, your A1C, it's a better picture of how your blood sugar is doing all day. We're talking about after breakfast, after lunch, when you're stressed, when you slept, when you go for a walk and exercise. You can see the impact of every choice that you make in real time. If you haven't talked to your provider about a CGM and you're managing type 2 diabetes, it's definitely a conversation worth having because that data changes everything. Okay, so now I want to talk to you about what your body is telling you when your blood sugar is out of range because these signs matter and a lot of people miss them or maybe they kind of dismiss them. High blood sugar, which we call hyperglycemia, it doesn't always feel dramatic and you may not always feel symptoms, especially when it's been elevated for a long time and your body has adapted to it. But here are some signals to know. You might have frequent urination. When your blood sugar is high, your kidneys have to work overtime to filter out that excess glucose out of your blood. So that means pulling more water into your urine so that you're going to the bathroom a lot more often, especially at night. And if you're getting up 2 and 3 times a night to urinate, and that's new for you, that might be a blood sugar sign and you need to get that checked out. You might have excessive thirst. I know this happens to me. This follows directly from frequent urination. If you're losing more fluid, your body is signaling you to drink more. The thirst feels relentless. No matter how much water you drink, it feels like it's not enough, and that could be a red flag. You might feel tired. When your cells can't access glucose properly, remember we use glucose for energy all throughout our body. Because of insulin resistance, they're essentially starving for energy. Even though there's plenty of sugar in your blood, your insulin is not pulling it into the cells like it's supposed to. And so you have glucose, but it can't get in where it needs to go. And this produces a profound fatigue, the kind that sleep just doesn't fix. You might have blurry vision. High blood sugar often causes fluid shifts in the lens of your eyes, which changes its shape and affects its focus. This can come and go with blood sugar fluctuations. And if your vision suddenly seems blurry and it's new, definitely check your blood sugar and make an appointment with an eye doctor. You might have slow heal. You might have wounds that heal very slowly because elevated blood sugar impairs circulation. It also impairs immune function, which are all critical for healing. So if you notice that you have cuts or scrapes on your feet or legs and they're taking longer than usual to heal, this is a significant warning sign, especially on the feet. Diabetic foot complications are serious and slow healing is one of the earliest signs. You might feel tingling or numbness in your hands or feet, and this is early peripheral neuropathy. The small nerves in your extremities are among the first to be damaged by chronic high blood sugar. Tingling, numbness, burning, or pins and needles sensation that wasn't there before means those nerves are being affected. You might also have frequent infections. High blood sugar creates an environment where bacteria and yeast thrive. So, recurring urinary tract infections or yeast infections, skin infections that keep coming back, are definitely worth investigating from a blood sugar angle. Now, let's talk about the other end of the spectrum, low blood sugar, which we call hypoglycemia. It's when the blood sugar drops below 70 milligrams. Now, if you're on insulin or certain diabetes medications, you need to know these signs for sure because hypoglycemia can move from uncomfortable to very dangerous very quickly. Sometimes you might feel shaky and trembling, and this is often the first sign. I know this happened to me multiple times, especially before I was diagnosed with diabetes in that pre diabetic range when your insulin is kind of going all over the place. Your body releases adrenaline when the blood sugar drops, which causes that shakiness and the trembling in your hands and even maybe your whole body. And it's your body's alarm system firing. You might often feel sweaty, and this is a classic low blood sugar symptom. Again, this is an adrenaline response. You might feel your heart racing or pounding, some palpitations, or noticeably fast heartbeat when you haven't been physically active, which is another sign that your adrenaline is pumping and that your blood sugar has dropped. Now, if you are not wearing a CGM, you definitely want to go and check your blood sugar to see how low it is, and then obviously intervene with a little bit of glucose candy or a little bit of juice. If it gets too low, you might start becoming confused or have difficulty concentrating because remember, your brain runs almost exclusively on glucose. So when your blood sugar drops, your brain is the first organ to really feel it. And you might feel a little foggy and unable to think clearly or suddenly having trouble with a simple task that's normally easy for you. Maybe you feel a little irritable sometimes, and this one kind of surprises people, but suddenly a sudden onset of irritability or anxiety or even feeling irrationally emotional can be a blood sugar drop. So if you find yourself suddenly snapping at people or feeling inexplicably anxious, maybe you haven't eaten in a few hours, you definitely want to check your blood sugar before anything else. And of course, you might feel hungry. Remember, our body is very smart. And so when our blood sugar drops, it really signals to our body, okay, we need glucose. So it wants to eat and it will have that sign. You'll have that hunger sign. Now, severe hypoglycemia, if your blood sugar drops below a certain level, and it's not treated, then it can escalate to seizures and a loss of consciousness. And this is definitely a medical emergency. Now, if your blood sugar drops low, you want to make sure that you drink a little sugar, typically about 15 grams of fast acting carbohydrates like juice, maybe regular soda, some glucose tablets if you have those on hand, or maybe a tablespoon of honey, and then wait for 15 minutes and recheck your blood sugar. And you might need to repeat it if it's still below 70. Once stable, you can have a small snack with protein to keep it from dropping again. And if it happens too many times, you definitely want to have a conversation with your physician because sometimes as you're making these lifestyle changes, and you're still on your medication, you will start to see some lowering blood sugar. So you want to make sure you're staying on top of this. And if you're seeing more lows, you definitely want to have a conversation about medication changes, possibly, which is not always a bad thing, right? All right. So normal blood sugar and optimal blood sugar are really not the same target. You want your fasting blood sugar between 70 and 90 if you can. Obviously, we're all starting from a different place. So if you're not there yet, do not beat yourself up. Just know with some lifestyle changes that we talked about in other podcasts, definitely check those out. You can get your blood sugar lower over time. Now, you never want to drop your blood sugar too low too fast because that can be very hard on your body. So you always want to go nice and slow. You want your post meal glucose under 180 as much as possible, and ideally under 140 if you want to be metabolically healthy. And you want to spend as much time in range as possible because time in range is what protects you from long term damage that glycation causes. And remember, glycation is a silent process where elevated blood sugar coats and damages your blood vessels and your nerves and your organs over time. So you don't feel that happening necessarily, but you can stop it from accumulating. Every day that your blood sugar stays in range is a day that process is minimized. Now that you know the signs of a high and low blood sugar, know for yourself. Now, if you want a tool to see your blood sugar in real time and really understand what's happening in your body, look into a continuous glucose monitor. You can check Dexcom, and they have a self-pay one at stilo.com. There are multiple ones out there, but usually your insurance will pay for it. But just talk to your doctor and see if they can get an order for you. This data will change how you think about food and movement and every other lifestyle choice when it comes to managing your type 2 diabetes. I know it changed everything for me, and I absolutely love it, and I can't really say enough about it. I'll share this with someone who needs it, and I'll see you in the next episode.